What if your body was trying to tell you something, but you weren't listening? Could you be missing the warning signs of a life-threatening disease like cancer? Our bodies often give us subtle signs and symptoms when something is wrong, but we may overlook or ignore them. While each type of cancer may present with its own unique symptoms, there are certain general signs and symptoms that can indicate the presence of cancer. Early detection and prompt medical attention are crucial for effective treatment and improved outcomes. In this video, we will explore 10 common signs that may warrant further investigation and highlight the importance of regular checkups and listening to your body's signals. It is important to note that the presence of these signs does not necessarily mean you have cancer, but they should prompt a visit to your healthcare provider for proper evaluation and diagnosis. Before we see the symptoms, here is a quiz question. Do you know the name of the latest and most advanced cancer treatment available today? Don't worry if you don't know. I have revealed the answer to this question somewhere in this video. Please watch the video until the end and don't skip. You'll know the answer. Moreover, all the symptoms I have mentioned are extremely important, so don't skip any part of the video. If you like this content, please like the video, subscribe to the channel, and hit the bell icon to see more such videos. Without further ado, let's see the symptoms. Number 10. Persistent, unexplained muscle or joint pain that doesn't go away or respond to conventional treatments. Such symptoms can sometimes be a sign of certain types of cancer, particularly bone cancer or blood cancers like lymphoma or multiple myeloma. The pain may be severe, constant, and not related to any injury or strain. It can affect any part of the body, including the back, hips, legs, or arms, and may worsen over time. This symptom can have many other causes, such as arthritis or fibromyalgia. Yet, it's important to get it evaluated, especially if it's accompanied by other symptoms like fatigue, night sweats, or unexplained weight loss. Number 9. Persistent, overwhelming fatigue or exhaustion that doesn't get better with adequate rest or sleep. Such a symptom can sometimes be an early sign of certain cancers like leukemia, lymphoma, or advanced solid tumors. This type of fatigue is not the typical feeling of being tired after physical exertion on a busy day. It's a constant, abnormal sense of extreme weakness and lack of energy that can make even simple daily tasks feel draining. The fatigue may come on gradually and worsen over time, making it difficult to function normally. Yes, fatigue has many potential causes, but if it is severe and doesn't improve with rest, it warrants medical evaluation, especially when accompanied by other potential cancer symptoms. Number 8. Persistent changes in bowel or bladder habits, such as constipation, diarrhea, or frequent urination. This can sometimes signal the presence of colorectal, bladder, or other cancers affecting the digestive or urinary systems. These changes may include narrowing of stools, feeling of incomplete emptying, urgency, or leakage. The changes tend to be prolonged and not just temporary issues. Bowel or bladder habit changes have many potential benign causes like irritable bowel syndrome or urinary tract infections. But if they persist without an obvious reason, it's important to have them evaluated by a doctor, especially if accompanied by other symptoms like rectal bleeding, abdominal pain, or unintended weight loss. Number 7. A cough that lingers for several weeks or hoarseness that doesn't go away. This can potentially be an early sign of lung cancer, throat cancer, or other respiratory cancers. The cough may be dry, harsh, and persistent, occurring for no apparent reason. Hoarseness refers to an abnormal change in voice quality, making it sound raspy, strained, or quieter than normal. A persistent cough or hoarseness is more commonly caused by non-cancerous conditions like bronchitis or laryngitis. But if these symptoms persist for over 3 or 4 weeks without improvement, it warrants medical evaluation, especially in smokers or those with risk factors for lung or throat cancers. Number 6. Persistent indigestion or difficulty swallowing can be a warning sign of certain cancers, particularly those affecting the esophagus, stomach, or throat. Indigestion may feel like discomfort, burning, or pain in the chest or upper abdomen after eating. Difficulty swallowing, known as dysphagia, can make it challenging to get food or liquids down smoothly. These symptoms often relate to conditions like acid reflux or hiatal hernia. But if they persist for several weeks or worsen over time, it could indicate a more serious issue like esophageal or stomach cancer. Any prolonged or worsening swallowing difficulties should prompt medical evaluation. Number 5, any change in the size, shape, color, or appearance of an existing mole or the development of a new skin growth. This can be an early warning sign of skin cancer, including melanoma. Changes to watch for include a mole becoming asymmetrical, having an irregular border, displaying inconsistent coloration, increasing in diameter, or evolving in height or texture. New growths that appear raised, bleed easily, or fail to heal are also concerning. Most moles and growths are benign, but any significant changes or new lesions should be promptly evaluated by a dermatologist, especially if accompanied by itching, tenderness, or other symptoms. Early detection of skin cancer greatly improves treatment outcomes. Number 4, sores or open wounds in the mouth, on the skin, or other areas of the body that fail to heal within a few weeks can indicate a precancerous or cancerous condition. Non-healing sores could signal oral, skin, or other cancers. Similarly, persistent sore throat, tongue sores, or white or red patches inside the mouth may be an early sign of head and neck cancers. Any seemingly innocuous sore that bleeds easily or doesn't heal reasonably quickly should be examined by a medical professional to rule out cancer. Number 3, unintentional weight loss of 10 pounds or more with no clear cause, such as changes in diet or exercise, can be a sign of an underlying malignancy. Many cancers can lead to weight loss through mechanisms like decreased appetite, difficulty swallowing, cachexia or wasting syndrome, which causes losing muscle mass and severe weight loss, or metabolic alterations. While other medical conditions like thyroid disorders can also cause unexplained weight loss, a doctor should comprehensively evaluate persistent, unintended weight loss to identify the reason. Number 2, the development of lumps, thickenings, or masses anywhere in the body, especially the breast, can be an indication of cancer. Breast lumps or changes should be checked even if the mammogram was normal, as they could represent breast cancer. Similarly, unusual swelling or lumps in the testicles, lymph nodes, or soft tissues deserve medical evaluation. While many lumps are benign, like cysts or lipomas, any persistent, growing, or painful mass warrants further investigation to rule out malignancy. At the top of the list, bleeding or discharge from any area of the body that is abnormal or unexplained can signal the presence of cancer. This includes vaginal bleeding between periods or after menopause, blood in urine or stool, coughing up blood from the lungs, or abnormal nipple discharge. While these symptoms can have benign causes, persistent or recurrent bleeding should be evaluated, as it may indicate cancers in those areas. Any unexplained bleeding requires prompt medical attention to determine the underlying cause. If you experience any of the symptoms mentioned, early detection through appropriate cancer screening tests and exams is key, as it greatly improves treatment outcomes. Screening commonly includes mammograms for breast cancer, colonoscopies for colon cancer, Pap smear test for cervical cancer, chest X-ray, computer tomography or CT scan, magnetic resonance imaging or MRI scan for lung cancer, prostate-specific antigen or PSA test and ultrasound to find prostate cancer, PET scans for many other cancers. Dermatologists can evaluate concerning moles or skin lesions. If cancer is suspected based on symptoms or screening results, further diagnostic procedures like biopsies, endoscopies, imaging scans, and blood tests may be recommended to confirm the presence and type of cancer. The earlier cancer is detected and accurately diagnosed, the better the chances for effective treatment and a positive outcome. Don't ignore potential warning signs or put off recommended cancer screenings. Paying close attention to your body, promptly reporting symptoms, and adhering to screening guidelines gives you the best opportunity for early cancer detection when malignancies are most treatable. Early detection saves lives. Now here is the answer to the quiz question. The question was, do you know the name of the latest and most advanced cancer treatment available today? The answer is immunotherapy. It is a type of cancer treatment that uses the body's own immune system to fight cancer cells. If you like this content, please like the video, subscribe to the channel, and hit the bell icon to see more such videos. Have a wonderful day.